Okay, I chose case 3 and case 4 for this project. So the first one was a 47-year-old man presents with severe pain in his right great toe. He's unable to bear weight on his right foot, and there was no apparent trauma. He reports the pain started last night and continued to increase in severity. He is diagnosed with gout. Blood work was done, and so was the urinalysis. His values are listed here. And then the question is, what's the best explanation for this presentation? So gout essentially is a metabolic disorder. It tends to affect middle-aged to elderly women and men. Women usually are postmenopausal. So essentially, monosodium urate crystals are deposited and can cause arthritis. The signs are red and inflamed and painful greater toe. So that's what's going on here. The root cause, there's 3 potential answers. There's overproduction of purines, decreased salvage of purines, and decreased urinary excretion of uric acid. The first 2 answers are not the correct ones. Overproduction of purines is incorrect because both the values would have to be raised, which in that I'm talking about the values up here, plasma urate and urinary uric acid. And that's the same with the decreased salvage of purines. Both values would have to be raised for that to be the answer. The most likely answer is decreased urinary excretion of uric acid. This is most likely the mechanism because of the samples levels listed above. The blood and uric acid is raised and urinary excretion is not raised. So lab diagnostics would include raised blood uric acid levels, a 24-hour urinary uric acid extension, greater than or less than 800 milligrams on regular diet suggests overproduction of uric acid. Examination of synovial fluid for monosodium urate crystals and leukocyte counts should be used for diagnosing. Treatments could include NSAIDs or steroids. And then, for more information, he later discloses that he just made a switch from diet soda to real soda, and could this impact the presentation of his gout? So the answer is yes. The high amounts of sugars that he's consuming can cause a flare-up of gout, which could be found in regular soda. I found this little blurb that I took from a paragraph that I cited here in my source. It says, in figures, this means that people who consumed 2 soft beverages per day were 85% at a higher risk of developing gout. Those who consumed it once per day were 45% at a higher risk for gout. And it says in the blurb above that he drinks between 4 and 5 liters of soda a day. So yes, the chances are very much increased. Down here are some resources from self-taught information. And then I chose case number 4, which would be a 58-year-old woman presents to the emergency department with progressive fatigue and weakness for the past 6 months. She is short of breath after walking several blocks. On review of symptoms, she mentions mild diarrhea. She has noted intermittent numbness and tingling of her lower extremities and loss of balance while walking. She denies other neurologic or cardiac symptom and has no history of black or bloody stools or other blood loss. On physical examination, she is tachycardic to 110 beats per minute. Other vital signs are within normal limits. The head and neck examination is notable for pale conjunctivitis and a beefy red tongue with loss of papillae. Cardiac examination shows a rapid, regular rhythm with a grade 2 out of 6 systolic murmur at the left sternal border. Neurologic examination reveals decreased sensation to, looks like I cut off. To light touch and vibration in lower extremities. No depression noted. The hematology consultant on call is asked to see this patient because of a low hematocrit level. Megaloblastic anemia is suspected. Which of the following vitamin deficiency is the probable cause? So the 3 options are iron, B6, and B12. Iron is a common cause of anemia, but it's not the most probable in this case. And the iron is where the blood lacks an adequate amount of red blood cells, which is what's responsible for carrying O2 or oxygen to body parts and tissues. A common treatment for iron anemia is just an iron supplement. This is not the most likely cause. B6 is another option, which is associated with mesocritic anemia, which relates to the mean corpuscular volume, which is also MCV, which you would find on a CBC. Or you can also tell an MCV is also the mean cell volume, if you prefer it that way. Which is also not the most common cause. B12 is most likely the cause because it's important for methionine synthesis, which occurs in the cytoplasm. It also catalyzes the conversion between homocysteine, and methionine. I'm probably saying that right. When vitamin B12 is deficit, it also affects cell replication and other metabolic pathways. Since the synthesis is affected in accordance with this deficiency, it can cause problems with the synthesis of carnitine, reduced neural function, myelin production, and decreased amounts of DNA and RNA. Discuss how this vitamin deficiency impairs purine or pyrimidine metabolism. So the lack of B12, vitamin B12, or folate decreases the production of purine. So that's how it's affected there. List potential laboratory tests and findings that would assist you in the differential. So a CBC just counts for all like the blood cell counts in your blood. So we use this on animals a lot. It would measure hemoglobin, hematocrit, reticulocytes. Those are all included in the CBC reading. And those levels would help confirm or rule out anemia. So when you look at a CBC, there's blood cells, there's hemoglobin, there's total protein, there's just all this stuff listed that would confirm or deny this. Let's see here. In case that if the reticulocytes are affected, a lactate dehydrogenase and bilirubin test might be warranted. There's also an MMA test that is sensitive to B12 and can specifically diagnose the deficiency. And here are some more self-taught resources that are down here. That's it.